now I'd like to have another big thank you to Sheriff Dennis Leema, who is the Sheriff for Seminole County and also the co-chair for Project Opioid.
Thank you, Dr. Morton. Good morning, everyone. It's so great to see the bottom half of your faces again in kind of a public environment and this kind of call to action. I want to thank all of the leaders of Project Opioid who have been engaged all through COVID-19 state of emergency with Zoom meetings and continued advocacy, but the hard work lies ahead of us. And I think that what we said and what we've identified now statistically is an unintended consequence of COVID-19 is even a greater demand on substances and the co-occurring challenges of mental health and disorder, and we're seeing numbers increase like never before. Quite literally in Seminole County, one of the most affluent counties in the state of Florida, great quality of life, wonderful school systems, very low unemployment rate. We revive nearly 3 people a day with the use of Narcan. Think about that. Last year alone, 741 overdoses in Seminole County, 109 overdose deaths, and the sad reality, we're tracking a 40% increase in overdoses and a 37% increase in overdose deaths. Those numbers and stats mirror the state and country. The largest group affected, millennials. 53% of all of the people overdosing are millennials. The number one leading cause of death of young people is a drug overdose. Disproportionate in communities of color, Black and Latino communities have a 110% increase because of the presence of fentanyl in all types of substances across the board. Many people that we're reviving don't even identify that they knowingly took synthetic opioids. This is a crisis like we've never seen before. We stand to lose more people ever in history, and we need to come together. This is why Project Opioid is so important. This is why I am so proud to see Project Opioid now expanding across the state of Florida, bringing leaders from all sectors of the community together, because collectively we can improve the conditions and save lives. When I think about what the greatest responsibility of any civilized society is, saving human lives is at the top of the list, and we're doing that. Project Opioid has been instrumental in spearheading projects in Seminole County that I feel will serve as the model across the country as we continue to expand out. Advent Health has been incredibly generous and actually has put together the Hope and Healing Center, the first of its kind public-private partnership with law enforcement in the private sector that is uniquely located directly across from our correction facility. And I want to thank Representative Scott Plakin, who's here today, because his work in this space, he has always been somebody that we can rely on. Thank you, sir, for your commitment. Rachel Plakin, his wife, who's running to succeed them. But $400,000 worth of state appropriations to help us get that program up and running. Thank you, Scott, for that. We have a bipartisan commitment. Congresswoman Stephanie Murphy has put in a $400,000 federal appropriation to get us up and running, and the generous executives at Walmart has given Advent Health $750,000. And that does not include all of the Rotaries and leadership Seminole groups and all of the people that are coming together to make this hope a reality. We've always said from the beginning that this is not a situation to try to make bad people good, but rather sick people well. And treating opioid use disorder as a disease and getting people the help they need is the course as we move forward. Making sure that everybody is aware of what's going on within their areas, because sadly, many people don't even know the numbers within their own area of responsibility. To keep out there on the front and talking about this, to make sure that everyone has access to the life-saving drug naloxone. It's on your tables right now. It's one of the pillars of what we stand for and what we represent, to make sure that people can do nothing more than deploy that and save lives if they're hospitalized and they get the proper medical treatment that they need. Knowing that medical-assisted treatment combined with cognitive behavioral therapy is the recipe that actually works. Look at the stats. And in Seminole County and now across the nation and state, with Project Opioid Health, we will ensure that all people have access to this life-saving treatment and therapy, regardless of their level of health care coverage. Uninsured, underinsured population, through the generosity of healthcare providers and those companies that are now engaging and involving, it's an incredible thing. We're also excited to talk about the expanding effort that we will now incorporate mental health through Orlando Health and Babette with Aspire Healthcare. We will dig in this year under the umbrella of Project Opioid to fix what I feel is a struggling mental health system. In Seminole County alone, we bank more than 3,000 people every single year. A high percentage of those people who are involuntarily admitted are being involuntarily admitted numerous times per month. So we will work hard to create a crisis stabilization center, very much like what we created with the Hope and Healing Center, where people can be triaged, evaluated, and then sent to the proper services, and connect the dots between opioid use disorder and the mental health struggles that go along with that, and not receive those services in separate spaces. This is the work that your leaders of Project Opioid are doing. This is how this call of action right now, we have always been engaged, but coming together is incredibly important because recovery is very much a social type of activity. Sometimes if you contact people, and telehealth, we've been extremely good with telehealth, but sometimes it's not until you look at a person and say, how are you doing? And they tell you, I'm doing fine. And you say, you don't look fine. There looks like there's something going on. We can do more. And I tell you, now's the time. I hope that people are getting vaccinated by looking at the people in the room who are not wearing masks and coming together. I think that this is something that we've done well with. People feel now comfortable coming out again. And now our advocacy and drive forward is going to be where we go. Again, across the country, there's nothing like Project Opioid that exists, that brings the faith community, the business community, the public and private sector to come together and collaborate and save lives. So with that, again, incredibly grateful for your service. I look around the room, I think I know almost everybody in the room, and I think largely we connected through your advocacy in this space. And you serve as such a strong voice for so many people that are not strong enough to have the voice themselves. At this time, I want to just take a minute to thank Andre Bailey, because Andre has been the founder and CEO and spearhead, and I'm telling you, the late calls, weekend calls, the advocacy, we've got a pioneer at the helm with Project Opioid, and I'm telling you, he's a true inspiration. He cares about helping people. And I'm telling you, we are in good hands when it comes to the direction that all of our leaders are going in Project Opioid. Andre, congratulations, brother. You're doing a good job, and I appreciate working with you day in and day out.